Welcome to Links in Pink, our virtual community forum brought to you by the Selma, Alabama chapter of the Links Incorporated. Knowing it exists is not enough. While it is true that 1 in 8 women in the United States will be diagnosed with breast cancer in her lifetime, it is also true that over 3.8 million women survive breast cancer in the United States. We empower each other by sharing our knowledge and personal experiences. Thank you for joining us as we move from knowledge to action. And now, our Health and Human Services Chair, Ms. Keisha Dozier Smith.
Good afternoon. My name is Keisha Dozier Smith, and I have the pleasure of serving as the Selma, Alabama chapter of the Links Incorporated Health and Human Services. And just as our Madam President, Evelyn Evans, mentioned, we welcome you to our Links in Pink virtual forum. Knowing it exists is not enough. The Links Incorporated has a long tradition of promoting and engaging educational, civic, and intercultural activities that enriches the lives of members of the Black community at large. As the chair of the Health and Human Services Committee, our goal is to promote and facilitate programs that support the maintenance of good health and the elimination of chronic health disparities in our communities through education, health advocacy, and optimizing the utilization of health resources. Community education about health risk is crucial, and the Links Incorporated plays a significant role in providing it. Today, we have a group of phenomenal women that are joining us on our virtual panel discussion today to educate, enlighten, and keep you engaged on the importance of breast cancer awareness and linkage to healthcare in the Selma, Dallas County area. I have the pleasure of introducing today's hostess, Ms. Phoenicia Nunn and Dr. Patricia Robinson. Ms. Nunn is a member of the Selma chapter of Links Incorporated, where she serves on various committees, including the Health and Human Services Committee. She is an educator of 20 plus years and has used her experience to help students in the community become successful in grades K through 12. Dr. Patricia Robinson graduated from Emory University and from the University of Alabama School of Medicine. She did pediatric residency at Emory University, where she was named Chief Pediatric Resident. She has been in private practice in Selma, Alabama for over 33 years, serving children in Dallas County and surrounding areas. She has received many awards for her philanthropy and service to the communities that she serves. Her most recent award was Best Pediatrician in Selma. She has been a member of the Selma chapter of the Links Incorporated for 20 years. Thank you, and we hope that you enjoy today's virtual forum.
Thank you so much, Madam Chair. It is my pleasure today to introduce our guest featured speaker, Dr. Sumi Oishiku, who is affectionately known as Dr. O. Dr. O is from Nigeria and is an advocate for women and a wonderful inspirational teacher. She is a graduate of UAB Selma Family Residency Program. She now works at Rural Health Medical Program Selma Clinic as a family medicine and women's health specialist. She is passionate about healthcare and patient education. She loves event planning, baking, and gardening. Dr. O, we welcome you today. And Dr. O, as you have heard Madam Chair say, we are very, very passionate in the Selma chapter of the Links in educating our community. And today we would like for you to talk about breast cancer, some of the risk factors, what is breast cancer, some of the signs, and some of the treatment modalities. Thank you so much, Dr. O.
Thank you so much for having me. This is a huge honor and a huge pleasure to be on with this program. I am just honored and delighted to be on board. So yes, I will be talking to you about breast cancer, the signs and the symptoms and everything to look out for breast cancer, because knowing is not just enough. We need to do more, but we're going to first talk about the things we need to know and then what we need to do after we know these things. So let me just put up my slide. Yes. Awesome, thank you. So like they said, I am a family medicine and women's health service provider at Rural Health Medical Program in Selma. I love the people of Selma. I love working in Selma. It's just very fulfilling and rewarding all by itself. And this special Breast Cancer Awareness Month, we really need to get word out there and let people get the right screenings necessary. So what is breast cancer? Breast cancer is, like we said, it's a malignant disease of the breast. It's the cancer of the breast. And in the US, it's the most common cancer after skin cancer and the second leading cause of cancer death after lung cancer. And in the US, we have over 3.8 million women who have been diagnosed with breast cancer. And however, since 2007, the number of women over 50 years old has actually started to decrease. And the death rate has dropped by 1% each year. And all of this was due to prevention and early detection and test treatment improvements. Next slide, please. So there's a lot of numbers to go through, but I'm not going to go through all these numbers. It's just to let you know that there's been an increase in number of women diagnosed each year, even though the number of women dying from breast cancer each year has decreased. But the incidence of detection or breast cancer is increasing. So we have currently about over 44,000 women that are currently diagnosed in the US. We have 281,000, and some have very bad stages, which is over almost 50,000 women right now. However, the earlier you detect it, the better the outcome. Now, these statistics are just averages. Each person's chance of recovery varies on a lot of things. So don't let the numbers scare you. But it's just trying to bring to reality that this is real. We're having an increased number of diagnoses, as well as even though the number of deaths is decreasing, it is still very significant at this time, and we need to raise more awareness about it. Next slide. So the breast anatomy, on the outside is just a bag of fat, but on the inside, it's much more complex than that. So the breast is made up of lobes and ducts, and each section has smaller section called lobules. The lobules end in those tiny milk bulbs that make milk. So note that breast cancer can occur in any part of this breast anatomy, from the nipple to the lobes to the ducts to the milk ducts. And at the top, you can see the lymph nodes. They kind of drain the breast. So breast cancer primarily spreads through those lymph nodes to the rest of the body. Next slide. So how does this breast cancer develop? So we have two types of tumors that form in the breast. And the younger folks, let me put it that way, they have a lot of lumps, but they're not tumor. They're called fibroadenomas or fibrocystic. They are benign tumors. That means they are not cancerous. However, there's also a portion of them that is malignant. That means that's the cancerous. Now, I try to summarize something that's very complex, which is genes mutate and miscode. It causes the cells to go bad. The bad cells multiply rapidly and then spread through the lymph nodes. So that is a very, very, very watered down interpretation of how breast cancer develops. We really don't know exactly what causes this to develop, but whatever the trigger is, it causes the gene to mutate. Mutated genes cause bad cells. Bad cells multiply, go through the bloodstream. And we have different kinds of breast cancer, but the ones listed are just, we're not having newer types of breast cancers, but the most common is usually the inflammatory breast cancer, the ductal carcinoma in situ, the triple negative breast cancer, and the Paget's disease of the breast. So what are the risk factors for breast cancer? I think this is the part that actually a lot of us get concerned about, like what happens? Unfortunately, the first and topmost risk factor, being born female. Yay, the free prize at the end of the gender. So being born female is just one risk factor you can't get rid of. Even if you're trans, you can't, because you still have those breasts. Well, if you take out the breast, that helps. Well, okay. But that is the main risk factor, being born female. And as you get older, which is inevitable, your risk also goes up. And personal and family history. So if either you personally have had either, say you had that ductal carcinoma, so like the stage 1 of the cancer in the past, you have an increased likelihood of having it again. You know how they sometimes say that the best predictor of the future is the past? It's kind of true in this instance, because if you've had it in the past, then there's a high chance likelihood of recurrence again. So, however, family history is very important, which is why we need to be having these conversations with our daughters, our mothers, grandmothers, cousins, sisters. I mean, sometimes we don't want to share our health secrets, but it's very important to talk about this, because you can help prevent the risk in other people. So if there's a mother, sister, grandmother, cousin, close family members, blood relative, not your in-laws now, but your close family members, if they've got that history of family, breast cancer in their family, then it puts you at an increased risk of getting it. Now, there are certain genes. Now, it's called the BRCA, but we usually call it BRCA. The BRCA1 and BRCA2 genes, these are inherited genes that has a high likelihood of breast cancer. And having dense breasts, you know, we used to think dense breast was the in thing for the fashion. It's good, very attractive, but also increases your risk. Now, not because the dense breast increases the risk, it's because dense breasts sometimes affects the mammogram readings. We usually miss a lot of, early stages of cancer because the breasts are dense. Dense meaning bigger breasts, kind of. So what are the ones that we can change? One is drinking alcohol. Now, unfortunately, there's no set limit of alcohol that works well. That is the safe limit. Just, a glass a day to 10 glasses a day, somewhere in between. Being overweight or obese, especially after menopause, I'm gonna circle back to that later. Not being physically active, that kind of ties into being overweight and obese. Hormone therapy after menopause, particularly with estrogen, and then starting menstruation early and late. Now, all of this has to do with one word, estrogen. I'm gonna circle back to that later too. Now, never having children or having your first birth after age 30, using certain types of birth control, and like we said earlier, having a history of breast conditions. But in all of this, the strongest risk factor is really being female and having family history of breast cancer, as well as the inherited genetic mutations. However, most women who develop invasive breast cancer do not have any of these risk factors. A good number of women don't know history, they just spontaneously get it. So even if you do have risk factors, anyone in the average population is still at risk, which is why we promote prevention, because it can affect. A lot of people who have it don't even have any of these risk factors. All right, next slide. Now, this slide I want to use to explain the different ratios, like the relative risk for different risk factors. At the top of the list is the BRCA mutations we talked about. There's the BRCA1 and BRCA2 genes. The way you can interpret this numbers is the higher the number, the bad it is. That's just a simple way of looking at these numbers. And it's trying to say that once you have the BRCA mutations, there's almost the over 100% probability of getting it. And then as you age, greater than 65, higher likelihood than less than 65. Now, breast density, the denser the breast, the higher the likelihood. And history of breast cancer in your family. So if there's a first degree is your mother, your sister, or grandmother. Those are first degree relatives. There's also an increased risk. The age of menopause, like we said, late menopause, early menarche, that's starting your period early and ending it late, never having kids, hormone therapy, all these increase your risk factors. Next slide. Now, the story of estrogen. Now, you're going to forgive my accent. Some people say estrogen, oestrogen, potato. So we'll just go with the estrogen. Now, estrogen. Now, the reason why I wanted to talk about this is because a lot of the risk factor is tied to the amount of time you were exposed to estrogen. Now, we all need estrogen. Estrogen is part of what makes us females, gives us the voice, the breast, the shape, and of course the fat. Everything that makes you female is courtesy of estrogen. So you can't do without it. So it's like that, it's like that good thing that could be bad if it's too much, So estrogen is made in the body. It's what develops and maintains your female sex characteristics. However, being exposed to estrogen over a long period of time increases the risk of breast cancer. Now, how are you exposed to estrogen for a long time? Early menstruation. So, like we said, estrogen is responsible for the female sex characteristics. So if you start your period early, which is part of kind of like the hallmark of being female, having your period, yay, not. But at the beginning, that was what, So if you start early, that means you have a longer years to be getting periods. And then if you were thinking, come on, 50, I'm done with this period. No, you're all the way to like 58 before you hit menopause. Longer duration of estrogen. And late pregnancy and never being pregnant, So this is not a reason to say go have a baby. But in addition to all the tax breaks, it is also good to have a baby because whenever you're pregnant, you have more progesterone and less of estrogen. So that way it's like saying the goal of all of this is you have increased estrogen if you've never been pregnant or if you get pregnant late, because estrogen levels are lower during pregnancy and breast tissues exposed to progesterone, not estrogen, during pregnancy and during breastfeeding. All right, next slide. So less exposure to estrogen, perhaps. Now, we can't do without estrogen. We need it. Like we said, we need it to be female, So early pregnancy, that's one of the advantages. Breastfeeding, which is another reason why we advocate for breastfeeding. Ovarian ablation. I'm sure you've heard of those celebrities who got rid of their ovaries just because you're the one producing the estrogen. I'm going to get rid of you. But it also comes with the side effect of being cranky and hot all the time and all those other things we won't talk about today. But some people get rid of it if it reduces their risk of cancer, especially if they have strong family history. Early menopause and late menstruation, that just means you have shorter years in between. Like if you start your period 15 years and you end it at 45, hey, less estrogen, less sanitary towels to buy. All right, next slide. So hormonal contraceptives. This has been controversial over the years. I actually had patients come tell me, I don't want that. They said it causes breast cancer. I'm like, yeah, no. So taking oral contraceptive may slightly, just a tad bit increase your risk of breast cancer. However, this risk decreases over time. Now, progesterone-only contraceptives does not appear to increase your risk of breast cancer. That means things like the Implanon, the IUDs, the Mirena, the Depo, they contain progesterone only. So those don't appear to have an increased risk of breast cancer. However, the oral combined, the ones that have estrogen and progesterone, if used for a short time, does not increase your risk. However, if used for a longer period of time, usually they say after 5 years or after 10 years, could slightly, just a tad bit, increase the risk. Next slide. Okay, signs and symptoms of breast cancer, the things we're looking out for, anything that looks abnormal from the usual. We've got the lumps, the breast, the most common is the lumps. You feel something abnormal, that's a red flag. Nipple discharge, if you're not breastfeeding, nothing's supposed to be coming out of those nipples, not blood, not milk. Dimpling, if it's putting in, looking different, if there's pain, the nipples are going in and coming out, change in skin texture or swelling, those are the red flags. Next slide. And what are the screening tests? We've got the mammogram, the clinical breast exam, the self breast exam, and the MRI. But the MRI is only limited to those with high risk breast cancer, such as those with the genetic conditions. Next slide. And what is the prevention? Mammogram, mammogram, mammogram. Early detection is the key to survival. Now, mammogram is not pleasant, I've heard, but you've got to get it. Now, the age in which the mammogram screening starts varies from organizations to organizations. But the American Cancer Society recommends you start at 40. But we have the American Cancer, we have the American Family Physicians, we have the American Clinical Radiography Association. All the different associations have different recommendations, but here's the take home. If you had a high risk, like we said, family history or the genetic mutations, you might want to start earlier at 40, and this could be every year or every 2 years. But definitely after 45, you need to get it every year or every 2 years, depending on your risk, all the way to 74. Now, when you get to 75, you might want to think about it. Do I want to continue this? This is if you think, if you're in pretty good health and you're going to live long after 10 years, you can continue. But if things are looking good or you're just about done, because sometimes after 75, they're like, you're more likely to die of other things that is not cancer after 75. So some people don't worry about it at that time. So self-breast exam, it's about looking, touching, lying down, feeling it. You need to get acquainted with your breast, not in a sexual way, but that's no way of knowing what is normal for you. So anything out of the ordinary, that's a red flag. Next slide. So I'm just going to skip through the next slides because I kind of explained why the different age limitations from different organizations. 40 to 50, they recommend talking with your doctor to determine your risk. There's a risk assessment your doctor would do to determine if you're at high risk. If you're not, you can wait till 50. But if you are, please start at 40. Next slide. The same with 75 and older. Next slide. So this is just saying, it gets to a point where when you get the news about being diagnosed with breast cancer, the next step is to stage it. 1 to 4, 0 means you ain't that bad. 4 means, oh, it's very bad. I'm sorry, forgive me. Next down. Next. So what are these? Are those the various treatment options? You could have a portion of the breast taken out or a lot of it. The whole breast taken out, radiation, chemotherapies, hormones, and those are just the treatment options available. Next slide. So prevention. There's no sure way to prevent breast cancer just because we said even if you do all these things or you don't do any of these things, you still are at an increased risk. But smoking, alcohol, weight gain, hormones, these are things that increase your risk. But being physically healthy, being on an average, maintaining a good weight, eating the right fruits and vegetables, breastfeeding, they help protect. Now, there's something I want to mention here. Processed foods. The reason why we emphasize more fruits and vegetables is that we prefer you eat some natural than processed foods, because processed foods contain a lot of chemicals that, we've not been able to prove it yet, but a lot of it has been associated with the cancer development. Next slide. And I think we ran through this to just say a lot of this is just saying tips: don't drink, watch your weight, eat healthy, exercise, have children. There's also tax benefit, and breastfeed while you're there. Next time. So if you haven't learned anything from this presentation today, you need to learn the ABCD of breast screening. your annual mammogram, your breast self-exam, your clinical breast exam. And when you feel something abnormal, even when you've had your mammogram, don't delay, don't deny, and don't dilly-dally. Just go for it. I think that's it. I think I'll take questions at this time. Thank you very much.
Dr. O, I know we have one question. What do you do with women who can't afford having a mammogram?
Well, depending on where they're located, particularly in our area in Selma, we have different resources and organizations that help to cater to women that don't have the resources to afford a mammogram. The first is the Alabama Breast Cervical Cancer Early Prevention Program. And then we have organizations and services that help, like the links that help provide mammograms for people in our community, like Selma.
Okay. Thank you so much. And we don't have any other questions in the chat. We would like to put up a slide that talks about some of those resources that Dr. O mentioned. We have a slide that has some resources that can be put up. And if we don't have that slide right now, we'll just go right ahead on to Miss Lydia Chapman. And Dr. O, we do appreciate this valuable information that you have shared. And we know that knowing is not enough. Women have to know what to look for, but then you have to have the resources to do that with. So the resources are not available for everyone. And that's one of the reasons why we asked Miss Lydia Chapman to talk to us today. And it's my pleasure to introduce her. Miss Lydia Chapman is a graduate of Pennsylvania State University with degrees in political science and communication that have afforded her the capacity to develop programs, marketing, and outreach educational plans for organizations in Alabama, Georgia, Washington, D.C., and New York. She currently serves as the grant program manager for Selma Air, providing comprehensive care for people living with HIV and prevention education across West Central Alabama. And she will especially talk today about her work with the Wellness Center. Thank you so much for coming, Ms. Chapman.
Thank you so much, Dr. Robinson, for your eloquent introduction. Thank you to the ladies of the Selma chapter of the Links Incorporated for hosting this exciting event and inviting me to participate because you didn't have to. I appreciate Mrs. Cachet Dozier-Smith, Dr. Evans, Mrs. Nunn, all of you all for your leadership, and to Mrs. Danielle Wooten for her wonderful, wonderful services. To my fellow presenters and to you, those who have taken time out to celebrate with us and to learn more about breast cancer. But not just breast cancer. For Black women and our health, we suffer in many other areas outside of breast cancer. I'll ask that the slides begin. Audre Lorde once said, "There is no such thing as a single issue struggle because we do not live single issue lives." This event is a reflection, very much a reflection of the fact that we do not live single issue lives. In fact, the intersectionality of our wellness is present here today. This event will call on us to think beyond the various diagnoses and to consider how we can work together to help those who may be living with a diagnosis, or to honor the legacy of those who are now our angels because of a diagnosis. Our health and wellness depend on a lot of factors, those factors that we may not even consider in our day-to-day lives. Everything from our family history and faith to our marital status, our personal habits, all of these things impact our health and our long-term goals. Our access to care, Dr. Robinson talked about it, right? Everybody doesn't have the same level of access. Our treatment options. Okay, I got to the doctor, but now what are my real options? What will my finances or my insurance, whether I have it or don't have insurance, right? What are the options that I have? And the successes that we experience along our journey to wellness. So I invite us to consider, we can move to the slide with the intersectionality of wellness. I would love for us to consider, what do we do for the women who are unaware of their need to perform monthly breast exams? Programs like this shed light on that. And for those, what about those of us who are aware but aren't quite sure of the proper technique? What about those women who are in our lives who know the importance of self checks, but because of past trauma or maybe even modesty, find it difficult to touch some of the most private and sacred parts of our body? What do we do for our sisters who have faced sexual abuse as children and are now living with physically abusive partners? Women who may consider making it through the day without getting hit or kicked an accomplishment, as opposed to, going to the doctor, right? Making sure that we get our annual breast exams or our annual pap smears. Those things have been placed on the back burner. What do we say to our colleagues who assume that, hey, my patient is married, she's over 50, and she's a good Christian? Or perhaps she's widowed, over 60, and she's a leader in the sorority. She doesn't need information about HIV. Why should I give her an HIV test? I say we challenge our sisters. We challenge our sisters to have courageous conversations. We challenge one another to share the health and wellness resources that are available. We use our roles, our positions, the things in our home, the things that we come into contact with our home, the people that we come into contact because of our home or our jobs. We push women and families that we come into contact with to promote these regular exams. And we make the information as accessible as possible. I love the example that Dr. O just shared about the ABCDs of breast cancer awareness. That's important because we have to make information accessible for everyone. All of us have not been afforded the opportunity to go to college. So what if you haven't done that and you have and you just simply don't understand the technique? You can remember ABCD. So making the information accessible, putting it where the goats can get it, so to speak. We can go to the next slide, please. This is important, and it's really, and so that everyone can see, Black women, these things are super important because Black women, y'all, these stats are really, really scary. The intersectionality of our health. We are 60% more likely to have high blood pressure, 17 times more likely to receive an HIV diagnosis, 50% less likely to be prescribed pain medication. There's a dear friend of mine, had horrible pain. Doctor did not believe her. Doctor after doctor did not believe her. And finally found a clinician who was willing to do the diagnosis that was necessary. She had the right surgery, but we are 50% less likely, half as likely to be prescribed pain medication, 3 times more likely to die during childbirth. We are underrepresented in data sets, which includes studies that are related to medical procedures or new drugs that are coming onto the market. We're 22% more likely to die from heart disease. Y'all, stress kills. We are among the most undertreated groups for depression. Mental health is important. We are 71% more likely to die from cervical cancer. That's why the annual pap smear is so important. Y'all, let's talk about the actions we can take. So how do we improve this? We talk to one another. We nurture ourselves and our own health care. If we could go to the next slide. To improve, we can eat healthy. Now, I know that sounds like a challenge, right? For some of us, if you have a busy life, fast food seems really convenient, but we can eat healthy. We can make simple changes gradually, choosing to grab that grapefruit on the way out the door instead of stopping by our favorite fast food restaurant that happens to be next door to the office, right? We get regular exercise. Just walking, 30 minutes of walking every single day drives down all of those risk factors that we can face. Lose weight if we're overweight. Most of us, many of us in this country, we're overweight. I'm an example of that. I need to reduce. That is actually a risk factor that Dr. O talked about with breast cancer. This is an important dialogue, y'all. Protect our skin. Just because we have melanin in our skin does not mean that we do not need some form of protection. So let's protect our skin. Let's drink water. Water impacts our skin. Practice safer sexual behaviors. I'll say that again. Practice safer sexual behaviors. That is not all connected to the actual intimate acts, but even it just really starts up here and having a plan so that you go into any situation with a plan and you're willing to protect yourself. We can stop smoking or using tobacco, limit how much alcohol we drink. Dr. O just talked about that as a risk factor for breast cancer. And ask questions when we visit our doctors. What happens when we leave the doctor's office and doggone it, I forgot to ask? Be willing to call back. Take notes. Write down those questions you may have before you get to the doctor so that in the moment, if your doctor seems to be rushing, you can say, hey, you know what? These are some things I'd like to go through with you. And ladies, I cannot stress enough. If your clinician does not have a bedside manner that suits you, does not feel that you should be asking questions, I want to encourage you to reach out to people who can direct you to resources, including another clinician. It is okay for you to ask questions of the people who are providing your healthcare services. Included in this array of services can definitely be Selma Air. Selma Air was founded in 1995. We have been about our business for 26 years, helping people with HIV prevention and care. So yes, we do perform HIV testing for absolutely no cost to anyone, regardless of your insurance status. But we also provide services for people who are living with HIV, wraparound services, so counseling and nutrition services for people who are living with HIV. I want to invite you to engage with the Rural Health Medical Program. They have an extraordinarily long history of providing top quality health care across the Black Belt. They have several offices. I believe it's up to 7 offices across 5 counties in West Central Alabama. And their care is not just for people who don't have insurance. So if you have insurance, whether or not you have insurance, you can see the wonderful Dr. O who has participated in this program today. The UAB O'Neill Comprehensive Cancer Center offers resources related to mammograms and research projects, research studies that are being conducted by professionals. In a previous slide, Black people, Black women, we are by far underrepresented in data sets needed to make sure that the services and the drugs that are being provided to address various diagnoses are customized to impact Black bodies. So we need to be a part of these studies. So the O'Neill Comprehensive Cancer Center, Cahaba Mental Health, Intellectual Soul Counseling. Y'all, mental health matters. We've got to take our mental health and wellness into consideration. And our physical health matters as well. So things like massage therapy, practicing yoga, or getting into a toning class at the Y, these are all spaces where we can, right in Selma, Dallas County, where we can take advantage of these services. And She's Ready. You see the logo here. She's Ready is a program that Selma Air is currently operating. We are recruiting members. This is a program dedicated to Black women between the ages of 25 and 50 and helping us. And I say us because I'm in that demographic. I'm a part of that sandwich generation that we're working, we're taking care of family, we're caring for aging parents or elders in our family. We are engaged in the community. We are doing all sorts of things. And guess what? Our own personal health gets tossed to the back burner. So She's Ready is helping to bring Black women 25 to 50 together to talk about our sexual wellness and the choices that we're making, but also it offers us a chance to get together and form that network that does not allow our sisters to fail. The last thing I want to do is to see someone who looks like me to fail with their health. I know what it is to normalize pain, and I don't want anyone else to endure that. So I just want to encourage everyone who is under the sound of my voice. I want love for you to share this video with those you love, put it on your Facebook page. And again, I just want to thank each of you all of the membership of the Selma chapter of the Links Incorporated, for this wonderful opportunity to share such valuable information. Thank you so much.
Lydia.
Yes.
Yes. Tell me, how does one get involved with the Wellness Center?
Okay, so to get involved with the Wellness Center, you can just give us a call. That number is 334-418-5055 at the Black Belt Wellness Center, which is a physical location where people from all aspects of life can just walk in. It is one of Selma Air's ways of reaching out to the community beyond HIV prevention and care. And so people can walk in, people can call. We have referral services. So if you're looking for that right physician to fit your needs and you are just wondering, well, hey, do they accept my insurance? We've done that research for you. Mm-hmm. So you can call us at 334-418-5055 and folks can stop by. We are located at 104A Executive Park Lane. We're right steps away from the Social Security office here in Selma.
Okay, and is there a charge?
There is no cost to the services we provide. We want to make sure that everyone has access to care.
Okay, and there's no, you don't have to be a part of any social, economic, demographic to be a part. If I wanted to come to the Wellness Center and get me a personalized program, I could do that.
Absolutely. And we have a mental health provider. Intellectual Soul is actually one of our in-house providers. They have a series of counselors, a number of counselors who are able to provide services in the areas of grief, particularly around, we have counselors who specialize in sexuality and sexual counseling, folks who may have experienced trauma related to sex. So we have great resources available. If we don't have them in-house, then we can direct you to them. So it's more of a referral. So we send a lot of folks over to Rural Health Medical Program. And we refer people, and we've done the vetting, right? We make warm handoffs. So we pick up the phone and say, hey, we're sending somebody over, as opposed to, well, yeah, here's a card, go there. Right. Okay. Because a lot of folks, it takes a lot for them to even come through the door or to make the phone call. Mm-hmm. So we want to make the process as simple as possible for people to receive.
And it's what I want to ask, when you say you make the referral, do you follow up on the patient?
Usually we don't even have to call them. We really, for the most part, most people actually call us to just say thank you. Thank you for making the referral. A lot. I tell you what, we actually launched this right before the COVID-19 pandemic became what we're experiencing. And it was so interesting as to how we initially started this, emphasizing women and sexual wellness. But then, because of COVID, we had to start referring people for care, for testing, right? And partnering with organizations who are performing COVID testing, as well as now folks who are offering vaccination. So that number again is 334-418-5055. For anyone who is interested, that is the Black Belt Wellness Center. It is a part of Selma Air. And yes, we do offer free HIV testing there, as well as referrals for other sexually transmitted infection testing. But we definitely can assist you with making sure that you have access to the proper care.
And you can assist them with referrals for mammograms.
Yes, absolutely.
Okay. And Dr. O, I have one question for you. I know we talked about breast self-exams, and some of the institutions are now saying, well, women don't have to do breast exams each month. I know personally, I still teach my young women to do breast exams because I feel that By doing that breast exam, that person is becoming self-aware of her body, and she is taking ownership of her body. And by touching your breast, touching, knowing who you are, that's a part of you. So I still recommend that, and I still teach my patients that. How do you feel about it?
I agree very much with you with teaching self-breast exams. And the only reason, or one of the reasons why the organizations are against it is that it leads to what we call overdiagnosis,
Yes.
particularly in younger breasts.
Right.
So typically under the age of 40, with each menstrual cycle, you'll experience changes in your breasts. For some people, they experience pain. Some would have like little lumps. We call them fibrocystic disease. Some might have, just some nipple changes. There's a lot of things that might happen with each menstrual cycle. And so if there's no consistent time where you check your breast and you just check randomly, it leads to overdiagnosis because while we're trying to teach the right things, sometimes knowledge brings anxiety and panic. So you're checking yourself in the shower and you're like, there's something there. And then you run to your doctor. Doc, there's something there. I feel it. I'm like, you know what? How about we watch it for about 2-3 months and see if it's still there? It might go away. No, you go somewhere else. And then your in-laws, you remember that they have the breast cancer, not your mama. Your in-law's sister's cousin had breast cancer. And then you tie it together. Family history, first lump, first pain. And then you run to your doctor's office. And, sometimes we just oblige and be like, okay, if it helps you, just to reassure, let's get the mammogram. So what happens is a lot of overdiagnosis. You get the ultrasound, typically under 40, we would do an ultrasound, or you get the mammogram. They do find a lump. You do go through the biopsy, but at the end of the day, it comes out benign. That means not cancerous. So the reason why a lot of the organizations discourages is that it causes a lot of overdiagnosis. But that being said, I also promote self-breast exams because, like you said, it helps you get familiar with what is the normal for your breasts, such that even if there's a lump, every month this lump pops up at that corner, so I know it's my period lump. Or, I get breast pain every 2 to 3 days before my period, that's normal. Or when I'm cold, my breasts become hard, that's normal, or things like that. So it helps familiarize yourself with what is the normal. And so there is no prescribed frequency. Before, it used to be immediately after your period, like a few days after, check it every month. But then now we're like, you can check it every other month or just every day if you want. But the goal is to get you familiar with what is normal for your breasts. And then the moment something is off, like the lump appears here, if it goes somewhere else, then that's abnormal for you. And you can tell the doctor, this is not the usual for me, and then we work, or we'll be able to work on that. So yes, we still encourage it, and it's kind of an individualized choice as well.
Okay. Thank you so much. And we'd just like to put up a little slide that helps show the audience some resources in Dallas County, the surrounding area, for women who don't have insurance or underinsured. The breast program that Dr. O talked about is called the Alabama Breast and Cervical Cancer Early Detection Program. This is a program from CDC, and it's in every state. And you can go through the Dallas County Health Department, or you can go online, or you can go through the Rural Health Medical Program, and you can apply for this program. And it can offer you services where you can get breast mammograms, pap smears, several programs, several services for women, and it's free. It's free of charge, but you have to qualify in terms of being eligible in terms of your income. So that's an excellent program. And then the American Breast Cancer Foundation offers free mammograms. And here at our local hospital, there's a low-cost plan for women who cannot afford mammograms, and it's through the charity plan at the Vaughn Regional Hospital. And there's also a program, a foundation called Joy to Life, and that's in Montgomery. And that program can offer assistance to women who cannot afford mammograms. And this is very important, as we have said. Mammogram, mammogram, mammogram. Mammogram is the best, it's the best tool for diagnosing early cancer. And diagnosis of early cancer is your best chance to become a survivor and decrease your mortality. And that is what we are trying to do. We are trying to help people survive. We don't want you to get it, but when you get it, we want you to survive. And in order to survive, you have to help yourself. You have to know what to look for, and then you have to act. And thank you all so much for coming, Lydia and Dr. O. We appreciate it very much. Now we would like to go into our next program, our next part of our program, and Mrs. Phanisha Nunn will take over. Thank you so much.
Now, we've heard a lot of information and research from Dr. O, and we just really appreciate you, Dr. O. Thank you so much. And we've also heard about some resources available here in the area and around the surrounding areas, and even across the state from Ms. Chapman as well. It's important for us to understand what happens once you actually find out that you have breast cancer, because surviving, as you heard Dr. Robinson say, is very important. So with us today, we have Mrs. Bromberry, Mrs. Frances Bromberry with us today. Mrs. Bromberry is a retired educator who still feels it is important to provide education to her community about breast cancer awareness. She is a proud member of the Selma, Alabama chapter of the Links Incorporated, where she serves as the HBCU chair. Yay, Ms. Bromberry. Ms. Bromberry is a survivor who is cancer-free. She was diagnosed with cancer in 2012. Ms. Bromberry, thank you for being here today with us and sharing your journey for breast cancer.
Thank you, Mrs. Nunn. It's so good to be here with you, ladies. I hope you can hear me. If you can't, let me know. Let me first let everyone know that I guess some 55 years ago, I was living in Germany, and I had a scare, and I thought that I had cervical cancer. And not, I guess, during those times, we didn't discuss a lot of things in our families and with our friends or whatever. But of course, I had the biopsy and everything came out fine. But as I grew older and I found out from my family that I had my father's mother had cancer, cervical cancer. And so that made me think about the fact that I needed to see about myself and to make sure that with anything that I had, I wanted to take care of my body. So, of course, traveling and then coming back to the United States, my physician and, of course, my gynecologist made sure that I would have my mammograms yearly. And with doing that, when I moved here, as time went on, traveling and teaching in other states, moving back to Selma in 2012, I had my regular mammogram here in Selma. And of course, my doctor referred me to Montgomery. And of course, that worried me because I had never had a second opinion for my mammogram. And so when I went there, the oncologist was very nice. And of course, he explained to me that he thought we better have a biopsy. And I did have that. And of course, it came back that it was positive and that he wanted to do a little further with me. And so in February of 2013, I did have my surgery on my left breast, and they found that I did have cancer. And so, of course, I've been doing the exams. I do those religiously, and I'm trying to make sure that I eat properly. But of course, you know, we as Black women, we enjoy good food, and I always enjoy eating, but I try not to overeat. But as you get older, of course, you know that you gain a little weight in places that you would rather not to. But that's life. But right now, in 2021, I am cancer-free. But what I say to my friends and to my associates and my family, please take care of yourself. Do your breast exams. I enjoyed Dr. O and Ms. Chapman's presentation. It was just right on the money for all of us. And just women, and we women of color definitely have to take care of ourselves. So I do have my exams yearly. I don't have to do some things right now, but I do have one doctor in the cancer center in Montgomery that I'm still going to. So ladies, always take care of yourself, eat the right foods, exercise. The only thing that I miss mainly is water aerobics. I love that. And I thought that helped me. And I have come through so much. And my friends, my Link sisters, my family, my sorority sisters, of course, I'm a member of the great Delta Sigma Theta Sorority Incorporated, but, and church members, and my husband, who has been wonderful. He's been by my side day one. So if it weren't for them and your love for each other, take care of yourselves. Make sure that you have your mammograms yearly. Don't take things for granted. And learn about your history, your family history. That's most important, because I found that since so many parts of my family have passed on, I am learning and I'm thinking about things that they've said in the past. But if you know your family history, go back and research it and see about things that have happened within your life, and make sure that you take care of yourselves. You have children, make sure that they do the same. It's important. And I love you all.
Ms. Brumberry, can you tell us when you found out that you had cancer, what were your treatment options?
Well, I had radiation. I didn't have to have chemotherapy, and I was very happy about that. And my doctors were very, very cordial, and they worked with me so that I had my radiation treatments here in Selma, so that I wouldn't have to travel to Montgomery. My husband wouldn't have to take me there. So, and having the radiation, it was good. The only thing, it made me a little tired. So when I came home, I would get a little sleepy and take a little nap. But it didn't take me away from doing other things. See, that was the only thing I was worried about. But I was happy that I'm able to open my eyes and see the light and know that you can survive.
You know, so many times people forget when someone has breast cancer, that it may be somebody's aunt, it may be somebody's mother, it may be somebody's sister, somebody's cousin, somebody's daughter, somebody's spouse. What advice would you give a woman who is newly diagnosed with breast cancer?
Well, I think first of all, you need to talk with your mate or your husband, and you need to talk about it, and feel free and ask questions of your doctor, your oncologist, or whomever. And I think you need to pray a lot. You got to go to him, because he's the one that makes you, and he makes each day possible for us to move. And so the Lord is important to me, and my church family and my friends. But I think you need to feel good within yourself. You need to be able to talk about it. Don't hold it in, because if you hold it in, you never will be free of the problem. And it's there, and you can't deny it. And so I think first of all, make sure that you feel good about it, and that you can accept that you will survive, and that you will be a survivor, and that it won't defeat you, but you will defeat it. So if it becomes to the point that you can't talk about it, then you are denying yourself to be happy. And so I think those are the most important things. Talk with your husband, your mate, and your family. Please be open with them. And we shouldn't hide it. I mean, I don't feel ashamed about it. I think to be a survivor, I'm very proud of it. And I do want to say this, Mrs. Nunn, that I want to thank my Link sisters and my sorority sisters for having me to be able to speak to other young women and young men, because remember, men have breast cancer also. And so for us to say to a man, oh, you don't know what I mean. Yes, they do. Men have had it, famous men. And so let's not say that it's only a woman's dream or woman's nightmare. It isn't.
One more question. Can you share with us, because you talked about, making sure you be open with your family. Can you share with us that impact that the diagnosis actually and the treatments had on your family?
Well, I think at that time, our youngest daughter lived in Montgomery, and it brought us even closer together, because she was here. She was near me as often as she possibly could be. But now she decided to move off to Minnesota and went off and left me, but that's neither here nor there. But my husband, it has made him stronger, and it has made our marriage stronger. And then on top of that, I was diagnosed with Parkinson's. So I've been through it, but I'm thankful that I'm here, and I can see you all, and I can laugh, and I enjoy life. And that's the most important thing.
Thank you so much, Ms. Bromberry. As you can see, breast cancer does not have to be a death sentence. These forums help us to open up dialogue for women of all types of conversations, and to take control of our bodies. It's important that we take control of our bodies, that we have these conversations, so that we can see that we do have survivors. This is not a death sentence. And from here, I'm going to transition to Dr. Robinson, and she's going to let us talk to the Miles family, unless we have some more questions for Mrs. Bromberry. I think that we don't have any more questions. We'll go to Dr. Robertson.
Hi, my name is Kashay Dozier Smith, and I serve as the Selma chapter of the Links Incorporated Health and Human Services Chair. Today, I will be bringing you a Did You Know Breast Cancer Awareness Moment. In 2021, an estimated 280,000 new cases of invasive breast cancer will be diagnosed in women across the United States, as well as an approximate number of 49,000 new cases of non-invasive breast cancer. There are over 3.8 million breast cancer survivors in the United States as of 2021. On an average, every 2 minutes, a woman is diagnosed with breast cancer in the United States. We encourage you, connect with your primary care provider, get your breast exams annually, and if you have a history of breast cancer in your family, share that information so that you and your family members are connected with the right resources to prevent breast cancer. Thank you, and I hope you enjoyed this Breast Cancer Awareness Did You Know moment.
Thank you. Our last segment today will focus on previvors. Now, you just heard from our chair about survivors, but we want to talk about previvors. And you may say to yourself, what is a previvor? Well, a previvor is defined as someone who has an elevated predisposition to being diagnosed with cancer due to a risk running through their family. And remember that only 5 to 10% of breast cancer has a genetic component. But if you're that 5 to 10%, it's important to you. And if you have a genetic component to breast cancer, you have an 85% chance of developing breast cancer. We want to talk about the BRCA gene, and you will always hear about the BRCA gene, but a lot of people don't know about the BRCA gene. Everyone has the BRCA1 and BRCA2 genes. These genes help repair damaged DNA within the cells. And however, some individuals inherit a mutation in one of their BRCA genes, which increases their risk for certain cancers, including breast, in both female and males, ovarian, pancreatic, prostate cancers, as well as melanoma. Today, we're going to talk to what I consider to be the poster family for previvors. We're going to talk to the Miles family, and it's my pleasure to introduce them today. Dr. Tanya Miles serves as the Selma City School Board representing District 4. She has worked for the Dallas County School System for over 27 years as an elementary teacher, principal, and district level administrator. She is an advocate for breast cancer awareness and a passionate spokesperson, using her journey as inspiration. She discovered she was positive for the BRCA gene mutation in 2007, and she is a proud 14-year previvor. She is joined today by her two daughters, Janae and Brianna. Janae Miles is a graduate of Alabama State University, Honeybee, with a BS in elementary education, and currently is a fourth grade teacher at Bruce K. Craig Elementary School in Selma, Alabama. She found out she had the BRCA1 gene mutation in 2018 and proclaims herself as a proud 3-year previvor. And lastly but not least, Brianna. Brianna is a sophomore chemical engineer major at Tuskegee University, where she serves on many committees and makes it her business to raise awareness of the importance of higher learning and opportunities. Brianna is the recipient of the 2021 Servant Leader Scholarship sponsored by the Southern area of the Links Incorporated. We are so proud and happy to have my poster family today for survivorship. And Miss Miles, a lot of people know your story, but there may be some people in our audience that don't know your story. Please tell us how how finding out about the BRCA gene mutation impacted your life and your family and your journey.
Hello, everyone. I want to thank Selma Links Incorporated for this opportunity for us to tell our story. Because as you say, a lot of people hear about the BRCA, they know about breast cancer, but a lot of people don't realize that there is a process that you can go through to find out if you have this mutation of the gene, so that you don't have to walk the path that a lot of our breast cancer survivors have walked. At the age of 10, for me, my mother was diagnosed with breast cancer. I was 10. She was 50. She was 52 because she had me when she was 42. And at that time, they didn't talk about back then. They didn't talk about those kind of things. All I heard was my mom was going to the hospital. Something was going on. My older sisters, they dealt with me. Mom had breast cancer, but the cancer that she had, it was caught in an early stage. So mom did not have to have chemotherapy because she never lost her hair. She had to go through the radiation process. And 15 years later, fast forward 15 years later, at the age of 25, I lost my mother to ovarian cancer. So never did we know about a genetic screening at that point, but we are going to assume because I have a gene and my sisters have a gene, my mom had that gene because she had both breast and ovarian cancer. And she had 2 sisters to pass of ovarian cancer. So this gene comes off my mom's side. In 1997, August, my sister Sherry James, she was diagnosed with breast cancer. So there we had mom and Sherry. Now both, we had lost mom in January, and in August of 97, Sherry was diagnosed with breast cancer. As a family, we pulled together, we supported her, we were there 100% every step of the way. After Sherry made it through her first diagnosis, my sister Veronica was then diagnosed. And so Veronica was diagnosed, I can't remember the year, but Veronica was diagnosed with breast cancer. It was in the early 2000s. And Sherry came back again. Sherry was diagnosed the second time. So Veronica decided that Dr. Charles Litt, I think, had been speaking with Veronica about the genetic screening. And so Veronica decided after she was diagnosed that it has to be something to this. We need to find out what's going on. So Veronica went to Kirkland Clinic, and they developed a family tree to kind of start tracing our genetics. And after Veronica was diagnosed with the breast cancer, she was found to be BRCA positive, and Sherry was BRCA positive. In 2006, my sister Carol, she was diagnosed with breast cancer.
Okay.
And with her being diagnosed with breast cancer, I'm now thinking, oh God, I guess I'm coming soon. And so they start talking, my sisters start talking to me about having the breast cancer genetic screening done. And I went screaming, hollering, kicking. I didn't go cooperatively, but I did go because I knew that I had 2 daughters, that if I did have this mutation in my gene, it was only fair that they knew. And my nieces, it was only fair that if they had to walk the walk, that they knew that they had options. And so I was the brave one. I went and I had my test in December of 2006. They took a vial of blood, sent it off to Texas. And in January of 2007, they called me with my results. And when they called me with my results, Doc, it was like someone had punched me in my gut to hear them say, you're BRCA positive, because that meant one of 2 things. I had to make some life-altering decisions, or at some point in my life, I would have breast cancer or ovarian cancer.
Did they give you did they tell you about your options of surveillance, chemotherapy, or in surgery? Did they go over all those things with you?
Well, I never had the option or needed the option of chemotherapy because I was never diagnosed with breast cancer.
That's right.
I did speak with my gynecologist and I spoke with a general surgeon to discuss my options. And after having much conversation with my husband and my sisters, my support system, and much prayer, talking to God, and I figured that if God had given me that information, He meant for me to do something with it. And so, with the
Knowing
support
it's
of
not
Leroy,
enough.
yes, so with the support of Leroy, I made some life altering decisions. I decided to have a total hysterectomy to make sure that I did not, I had both, I had two gorgeous babies, so I did not need those ovaries. So I happily gave them up because I suffer with endometriosis as well. So I gave those without fighting. And then when it came to my breasts, we decided that it would be best for me to go ahead and have a bilateral mastectomy. And I did a total reconstruction with TransLab. It paid at that time. I was a little thicker, I say finer than what I am now. And so they were able to reconstruct my breasts using my belly fat. And my belly fat saved my life in a sense, because that's how they were able to go back and reconstruct my breasts. And after I made all my life altering decisions, I'm here. I'm here to tell a story. But it was always my prayer that my girls would not have to go through or hear that you're BRCA positive. But prior to my girls, my sister Veronica, her daughter Tiffany found out that she was BRCA positive. And in the process of finding out you're BRCA positive, you have to start a process. So you're either going to go get a mammogram, you're going to go to get MRIs. MRIs are going to be better because if you have, as Dr. O referenced earlier, if you have dense breasts, it'll be difficult sometimes to see what's going on in there. So the MRIs, they provide more, the films provide more accurate of what you have going on in your breast. And so I had to get an MRI of my breast and I had to get ultrasound done of my ovaries. And so Tiffany was doing the same thing when she found out that she had breast cancer. So Tiffany was diagnosed with breast cancer at the early age of 28. And she was early stages, but she went through with the chemo and everything. And so in 2008, I kept saying, okay, God, so I've gone through this. It's going to stop with Tiffany. Well, when Jay got to college, her gynecologist thought it best, because she knew our history, that she would test Jay. I didn't know that the test was taking place. I knew about the test when Jay got the results. So the doctor called Jay with the results. And Jay, you want to jump in here?
Jay, as a young person, what was the impact about you finding out that you had the BRCA gene mutation?
At first, it was really, really hard because I was 18, 19 when I found out. And at that time, of course, I'm at the peak of my life. I'm in college, living my best life, no husband, no boyfriend at the time, no children, just young, living my best life. And I got the results March 26th. I was eating a chicken tender sandwich. And my phone rung, and it was the doctor, and she was telling me that I had tested positive. And at the time, I didn't understand, and I just remember asking God, God, why me? Why did I have to go through this? And just in a lot of prayer and from my support system, a lot of support from my support system, I remember my cousin telling me that, why not you? What makes you so special that you can't fight this battle? What makes you so different that God couldn't choose you? And so it was really a spiritual battle for me. I was just wondering, like, why did God decide to allow me to go through this? And I just ended up, after I began to just pray a lot of prayer and a lot of support from my family. That's how I've been able to cope with this situation. But I now have to, go yearly to get the mammogram and also an ultrasound of my ovaries. In the process, I did lose an ovary because the cyst that they found in my ovary was big, and the doctor could not save my ovary. She had to take my ovary. So just my process through this.
Mm-hmm. Okay. And would you recommend, you would recommend to any young lady that has a higher risk, a family member that has breast cancer, to find out if that
Yes.
person?
I
Yes.
do recommend self breast exams monthly. I don't recommend any ladies to ignore anything on their bodies. Know your bodies, ladies. And like I tell my mom all the time, feel on yourself, touch yourself. That's the part of self-love. Like, just
That's
love
right.
on
Know
yourself.
yourself.
And with loving yourself,
That's right.
touch your body all
That's
over.
right. This is yours.
It's yours. So know
right.
what's on your body. Do not
Mhm.
ignore. Do not be afraid.
Mhm.
This is nothing to be embarrassed about.
Mhm.
I say, those of you who know, I have a makeup business, and it's called Uniquely Jade. And having this BRCA1 mutation makes me unique. It makes me who I am. So yeah.
Okay. And Brianna, how are you?
Hello, good and you?
Oh, I'm just fine. Now, you decided to get tested, of course, for the BRCA gene, and you are how old?
I'm 19.
You're 19. Okay, great. And do you have good news?
I do. I have good news. My dad's genes in me are a little stronger than my mom's. And I tested negative for the BRCA mutation. Going through that process was very, very scary though. My mom called me. She woke me up out of a nap one day. And she was like, hey, I just left Dr. Clark's office. We talked about it. She wants you to get tested. So we're going to get you tested. And she was like, all right, I'm going to call you back. So I'm like, huh? Like, it was just very, very nerve-wracking. I was on edge. I didn't know what to think. I was anxious. So leading up to the day, I was just like, Lord, you know, I can't handle this. I can't do this. I don't want this, But I conquered my fears and I took the test. And I got tested and I got my results back and I am negative. I went in there thinking that I was going to be positive, but the Lord is bigger than any and every situation. So I am indeed negative. So I've watched my mom and my sister and my aunts and cousins and all of them go through it. So I think of myself more as a advocate than anything. Everywhere I go, I'm talking about, the importance of knowing your body, self-exams, like making sure you're going to the doctor. So I consider myself an advocate.
Okay, well, thank you so much.
Yes, ma'am.
Dr. Robinson,
Yes.
and one reason with Brianna, because they had been trying to test her since she was 16. And I kept telling the doctor, no, I'm not ready. I just can't take hearing that. And so really my fears, I put my fears over my faith. That's what I did. And my sister Veronica said to me one day, Tanya, we cannot let fear cause death.
That's right.
And in telling us that that's when they decided to test her. And I watched Bree at church last Sunday. And because we did not, had we done this Zoom last week, we wouldn't have had her results. So I watched that church Sunday and I was like, she's real tensed and she's just real anxious. And I was like, Lord, please just give us some peace. And Monday is when I called because it had been over 10 days and we hadn't heard anything. And when I called Monday to tell them, we haven't heard, we need to know something. We need to give her some peace. I guess the nurse thought, this lady is crazy. When she gave me those results, I broke out to an all-out praise on the phone with the nurse. And I was like, okay, Tanya, gather yourself. Let this lady off the phone so that you can call Brianna. And I called Brianna, and you would have thought that I had given her a pot of gold when she got those results, because it is nerve-wracking. And I'm just so glad she does look like her dad, and I am so glad his genes were stronger than mine.
Okay. And Janae, what were your treatment options? What did they give you options to do?
When I first found out, the first thing they told me to do, well, once I got my the images, when I had the mammogram, they looked at my body, my breast, nothing was detected. Now where it came in with my ovaries, I got my ultrasound, and on my ultrasound, that's when they found the cyst. When they found the cyst was the size of a grapefruit. I never had any pain. I was shocked that there was even something on my ovary because I never felt anything. And the doctor told me that the cyst was too big to give me pills to decrease it. So we had to remove it surgically. Well, when we got in for surgery, by the time so that was March. By the time I made it to surgery, which was June 1st, I think it was June 1st.
It was June 1st.
By the time I made it to surgery June 1st, the cyst itself had grew to the size of a cantaloupe around my ovary. So that was me losing my ovary because the Dr. Clark told me that she had to drain just a liter of fluid off of it before she was able to remove it, and it was touching my stomach. So just me going through the process of, still just having the knowledge. I do go yearly for my mammogram and for ultrasound, and then Dr. Clark, reviews it and just inform me, and I just make sure I'm taking care of myself yearly.
Okay. And Tanya, one more question. And this is something for young women who are your niece's age and do find out that they have breast cancer. Talk to us about freezing the eggs. She froze her eggs, and I think that's very important for women to young women who do have to go through chemotherapy, who do find out that they have breast cancer at that 25, 26, 27-year age, and they're not married, but they want to have the possibility of having children later. Talk to us about that, her thought processes about that.
I'm not sure the process, but I think eggs, because when you go through chemo affects every aspect of your body. The red demon, as they call it, I think right now to this day, none of my sisters drink anything red because of the chemo, the color of the chemo and everything that's going into their body. But if some women, I'm not sure how expensive it is. I'm not sure if insurance will cover it. But if you have those options, if you've not had a child and you can have eggs and things harvested prior to pre-chemo, so that after you make it through your treatments and everything, you still have options of becoming a mother and things of that nature. As Dr. Clark told us with Jay, just because she's lost an ovary, it does not mean that she will not be able to bear a child. Women still can bear children with one egg. With one ovary. We don't want her to test it out just yet. But when she meets the right man and gets a husband and things of that nature, then she can find out. We'll have another testimony at that point. But my niece, she has a testimony. She was able to, after going through chemo, she was able to still have a beautiful baby boy. Healthy, beautiful baby boy. She had a healthy pregnancy and things of that nature. So, yes. I
just wanted to bring that out because sometimes we make decisions about not going through with procedures because of the fact that we do want to be mothers, and sometimes we'll delay going through a procedure because of that. And I just wanted the audience to know that there is a possibility that you can have your eggs frozen, and then when you are ready to have children, if you can, that you can have kids. Thank you all so much for being here today. And as I said, I think we went full circle We started off with talking about knowledge, prevention, survivorship, and now we're talking about pre-survivorship. That is being proactive, and we want you to be proactive so you don't have to be a survivor. So not only knowing about the BRCA gene, but also knowing about your family history, but also remembering decrease your alcohol consumption. That's a risk factor. Decrease smoking. Get exercise. That's easier said than done. Stay healthy. Just do the best that you can.
And Dr. Robinson, just like breast cancer survivors are celebrated in October,
Mhm.
pre-vivors, we're celebrated on September the 26th. And
That's
our
right.
colors are teal and pink. There's a two-tone ribbon that represents a pre-vivor.
Okay. Well, thank you so much again. And Brianna, we're happy for your news. And Janae, you gave a beautiful testimony, and I'm so proud of you. I've been knowing you since you were this big. So thank you so much. I
Thank you.
appreciate everything. And Miss Miles, now you know we appreciate you. And we appreciate everything you do for Selma, Alabama. Thank you so much. And now we will turn the program over to one of our members, Miss Monica Gale.
We want to thank you so much. Oh my God, that was a beautiful breast cancer awareness forum. Great information. Just, oh goodness, the guest, everything is beautiful. On behalf of the Selma chapter of Links, we would like to just thank you all for being a part of it. And we want to give a special thanks to Dr. O of Rural Health, Lydia Chapman of Selma Air, the Miles family for sharing your journey, and our own Miss Frances Bombery for sharing hers as well. Our community partners, Rural Health, Selma Dallas County Health Department, the TLM Obstetrics, Gynecology, and Women's Health of West Central Alabama, located in the Medical Towers at Vaughn Regional Medical Center. For questions, please email them to selmalinks@gmail.com. Also, you may email Dr. O, and her email address is on the screen here. It's info@rhmpi.com. Lydia Chapman at Selma Air. Selma Air Educator at gmail.com, or you may call 334-324-6271. And don't forget to complete the survey. The link is listed there above. So if you don't get a chance to get it here on the during the webinar, you may log back in and look back at it so you can get that survey completed. You'll be entered into a chance to win a gift card. So please complete that survey. And again, we want to thank you all for tuning in. Have a good evening. God bless. Unless our hostess want to have a last word or anything to say.
No.
All
Thank
right.
you.
Well, thank you, everyone. Have a good evening.